All right. Good afternoon, everyone. Thanks for joining us. My name is Jamie Seward. I'm an Associate Director of Affinity Engagement Programs with the Johns Hopkins Office of Alumni Relations. And before we proceed, I'd like to acknowledge our co-sponsors, the innovation initiatives here at Hopkins. So before I turn the program over to our moderator, Tatiana, I encourage you to ask questions by either typing them in the Zoom Q&A at the bottom of your screen or in the chat. We'll have time to answer your questions at the end of the program and maybe even during the program. So now I have the pleasure of turning the program over to our lovely moderator, Tatiana, who is one of our amazing Healthcare Affinity volunteers. And I thank you, Tatiana. I'm so grateful for your help and participation. So I'll turn the program over to you.
Thank you so much for that introduction, Jamie. And yes, thank you everyone who's here today with me. We're really excited to have Tim Hwu from Standvast Healthcare Fulfillment. And just to echo Jamie, we want to say thank you to, the alumni relations who has been helping us out, Johns Hopkins Tech Ventures who we're partnering up with, and Johns Hopkins Innovations to bring this series to you. This is actually our second interview, and we're excited because it started and now we're going to keep it moving because we see that everybody is interested, and we definitely want to bring you lots of events and programs that touch on the topics that you're interested in. So yeah, wanna first welcome Tim Hwu to speak with us. We're super excited to speak with you. Thank you so much for spending some of your time with us today. And well, I know that a lot of the participants got to read a little bit of your bio in the RSVP page, but I don't think I can provide an amazing intro as you deserve. So we want to, you have such an amazing background and it just spans so many different areas. We're very proud that, of course, you're an alum of Hopkins. But if you can tell us a little bit more about your background, that would be a great way to start. So thank you, Tim. Welcome.
No, thank you, and it's my pleasure, and I very much appreciate the group taking the time and being able to speak with everyone here. So again, my name is Tim Hwu. I'm a co-founder for a healthcare supply chain business called Standvast Healthcare Fulfillment, and I think we'll get into the business a little bit later, but essentially, it's a supply chain fulfillment systems process, and physical fulfillment for the hospital systems and other healthcare providers. So as a co-founder, I've been involved with everything from the company, but really more specifically, I head up sort of the client engagement and own the product commercialization strategy at Standvast. My background, I've been in a lot of different roles, working at some of the sort of the largest companies in the world. I've worked at IBM, Ford, Google, and one thing I'll share is that at Google I worked in probably, to me, one of the more interesting projects, which was the book digitization project, where they were scanning all the library books around the world into Google's catalog. And so I owned
Google Books. Yes.
Yeah, Google Books. Yeah, so I own this sort of scan. Internally, we called it a really weird name, obscure name, but I guess Google Books is a more popularized name. But so I own the scan operation process in that project, and but essentially, my career spanned anything from IT. I started my career in IT, moved into supply chain, logistics, sort of operations, dabbled in finance along the way, and then moved into sort of management leadership roles, and then that's kind of what eventually got me into where I am today, starting our own business.
Yeah, no, thank you so much for providing that background. And, you talked a little bit about some of those roles before starting Standvast. How did these roles help you pave the way to being an entrepreneur?
So each role sort of brings us something different to my background, I think. But I'm working at some of these sort of very visible brands. Really got me, I think, a front row seat to see some of the really amazing successes with these companies, as well as some of the pretty monumental failures. And so each each company, not only my role in particular, in these companies, what I did, but also just watching the company's operations, the organizational structure, and all those different pieces. You sort of take things that you think work really well, and then you try to emulate that, or you try to learn from the mistakes, and you try to say, okay, well, when I do it myself, or if I, whatever role I'm in the
If I
future,
were to do it.
yeah, just don't do that again, right?
Yeah.
And so all these companies, because of how large and the scale that they have, they're involved in so many different things. So it's, for me, being able to sit in the seat that I was in, you can really learn a ton in those. But I think really, if I look back at all the projects that I've worked on, the positions I have, it's really about creating supply chain solutions, whether it's for building computers, building cars, delivering rare collection books around the world, whether it's delivering consumer goods or getting them back out of stores. And from a return perspective, it's really about moving product around, getting supplies to where they need to go in a very kind of efficient manner and cost, and with a level of high quality, right? So it sort of adds up all to what we are doing today at Standvast, which is trying to make sure that we can get the products into the hands of the providers, into the hands of the nurses and the patients who need it at the right time, in the right, with the right parts, components, and at the level of quality that's needed.
You make that sound so simple, but it's a lot of different components kind of, and the constellations have to align. Of course, I'm sure you use a lot of data to get that done, right?
Yeah, and so the one thing, and I'm sure folks on the call and everybody in healthcare, one of the struggles is that there is so much data out there, and how do you kind of piece it all together into useful information and into something that you can actually take action on, and not only take action on 6 months or a year down the way, but take action on pretty quickly, immediately. And so one of the things that we've been able to do is to say there's bits and pieces of data available in all these different systems, and because of our experience working with large companies and systems, we I don't want to say, we're pretty adept at finding ways to sort of piggyback off of existing platforms, existing data feeds, existing systems, or we go and work with it. We know how to explain to the IT teams what we're exactly looking for, how to craft that feed. And so we're able to extract the data that's needed. So for example, in the procedural space inside a hospital, they have schedules, they have preference cards, they have a lot of the data that's needed essentially to create a custom order for a surgery. And so why isn't it being used? Why isn't it being used to plan, not just the day ahead, but month ahead? We didn't understand that, and we so that's why we came up with the solution we came up with, is to say, let's leverage the data you already have, and in return, with our process, you can actually gain real-time data of what was actually used, what was wasted, what was being returned, and be able to gain best practices and gain optimization strategies and gain recommendations that you otherwise wouldn't have, because you're not using the data that's really available at your fingertips.
Wow, that's wonderful. So back to the entrepreneurship journey, is this something that you always wanted to do, or was it more that you saw the opportunity and you were like, this is great, I'm going to go take it?
Well, if you, as I mentioned, the type of work that I did or the companies I joined, you can probably tell by that kind of my professional journey that I'm not necessarily the biggest risk taker, right? Going to work at IBM or going to work at Ford or even Google is not necessarily about taking risks, but what I've learned through those different positions is really about trying to understand, like I said earlier, like trying to understand what worked, what didn't work, and the frustration of not being able to impact something that you feel like it's, there's a better way, there's a better solution out there. And so so it is not necessary in my back of my mind always to say I want to go start a company or I want to be an entrepreneur. In fact, it was probably one of the lower things in my to-do list
Really?
at certain points in my career.
Hmm.
And I'll give you an example of how risk averse I was, right? I mean, when I left to go back to graduate school in 2002, I was so worried because it was a dot-com bust and everybody sort of losing their jobs that I made sure I took a leave of absence from my company so that I was somewhere to come back to after I got my graduate degree. So I wasn't even thinking that far ahead of saying, oh, I'm going to go get a graduate degree and I'm going to go and advance my career and move in this direction. I actually thought about making sure that I got something still behind me that I can come back to if needed. And so, but over the years, I think what I realize is that, there are things that it is, if you don't you can't wait for the stars to align before you sort of take that next step, right? And you can't necessarily decide not to make that next move just because you feel like the environment isn't perfect or great. Sometimes you just got to do what you got to do. And I think for me, over time, I came to that realization. And so when the opportunity came up for myself and my co-founders to take that leap and say, you know what, we've done a lot for a lot of different companies, right? Why not take that learning and build something that we can then craft from the start? And that's kind of how we got here.
No, that's great. Those are some great points, especially for, the attendees who may be kind of in that time of their lives, also trying to figure out, do I stay in industry or do I, develop solutions to these market problems?
I don't know if there is a right answer for everybody, but definitely, for someone, and like I said, I'm a fairly risk averse person, through my career so far. And so for me to take this leap, I think it was a culmination of a lot of different experiences that I've had, and ultimately coming to a decision that to be able to help someone solve their problems, build new solutions, you almost have to come up with, you almost have to go your own way a bit.
Great, thank you. And what are some of the supply chain problems that Standvast is uniquely positioned to solve? And how is Standvast providing these solutions? I know you talked a little bit about the data, leveraging that data, but particularly in healthcare, supply chain is very complex.
Yeah, and so supply chain really is a core component of healthcare delivery, right? But it's become, really a major cost and headache to a lot of healthcare operations. Current sort of solutions out there focus a lot on driving down pricing and increasing buying power and negotiating power in order to drive down pricing, right? And so what that really entails is you got to standardize, you got to cut down on the number of SKUs that you're buying, and you got to be able to buy in bulk or partner with someone who's going to do the work for you to break it down into a low unit measure. And what we, and there isn't a lot of information being exchanged in that supply chain as it stands today, because it's all about pushing the goods out into the hands of the provider, because they don't have the signals to say, what do I need next week? What do I need tomorrow? What do I need 2 months from now? And so the solution became, let's just fit as much goods as we can into the four walls of the hospital to make sure we have it. Yeah, let's stock up, right? And we even hear, I think, the rule of three, right? We need at least 3 of everything in order to make sure that we have one to use, have one to be on standby, and have one to be, just in case, that you drop that backup, right? So there is that natural tendency to just buy as much as you can, but in doing so, you also end up ignoring a lot of the needs of certain specialties or certain doctors who have special capabilities or special needs for certain product that they now can't get because of supply chain rules or because of standardization. And so our solution really started with, and our capability, our background. So one thing I'll share is that a lot of our team came from Amazon Fulfillment. And so the concept of needing to stock up because you don't know what's coming is not as much of a problem for companies like Amazon, right? They, people are getting used to being able to click a button, and even within an hour, something will show up at your doorstep. And so what our company and our capabilities is really thinking about is saying, let's just start designing the supply chain from the physicians and the patients backwards, right? Let's figure out what is needed at their endpoint and make sure that we're planning. We have the tools and the planning capabilities and the fulfillment capabilities to not only make sure that we have the right product in stock, but when you push that button or when you need that product, that we can then take that order and package it and get it exactly the way you want it and deliver it to you within the short amount of time possible. And so really decreasing that lead time from the point that a doctor or a nurse realize they need something to the point that they can actually get it, or even completely eliminating that and anticipate what they need and getting it to them before they even ask for them would be the next evolution, right? So I think given our background in e-commerce fulfillment, given our background in using data to solve problems, given our background in actual in process improvements, efficiencies, I think this is why we think we can bring a well-rounded approach to solving a supply chain problem that I think the industry really spends probably too much time on just trying to force pricing down.
No, that's gives us so much to think about in terms of, healthcare. What do the providers need? And especially as they're innovating, right? As they're innovating, they're not going to use the same standard, devices or surgical instruments. As they're developing new and model therapies, they're not going to use the same medications or interventions, right?
Yeah, and through this journey, I mean, I've had the opportunity to really go in and out of a lot of hospital systems, and everywhere from their basements to watch their supply chain operations to into the operating room and watching a surgeon operate on patients, to their boardrooms and watch how they sort of talk about financial planning. And so I've been in and out of so many of these different places, but when I watch the actual doctors perform the surgeries, you realize that their challenge with the patient on the table is to not have to worry about what parts do I have available, right? And I especially remember this case where the surgeon was trying to perform a surgery, and he walks in the room and he asked for a part, and they said no, they don't have that today. They think they'll have it back tomorrow. And you can see his face just sort of, okay, and
I don't have what I
start,
need.
and then start to think about like, okay, so what do we have? And then people are running in and out of the room trying to tell him what they have, and he's trying to create a strategy and solution that he thinks will work, in this particular instance. And you realize that supply chain and worrying about parts really shouldn't be on their mind, right? And their job is to take care of the patient, and supply chain job is to get them the product that they need and to solve how to get it to them in the most economical, efficient way possible, so it's no burden to the patient as well.
Yeah, and we think about all the resources that can potentially be wasted, OR space, booking that OR, right? Prepping the patient, all of those things. If you don't have what you need, you can potentially cancel that procedure.
Right, and that's obviously one of the concerns and worries that they're always managing in the OR, is making sure that the OR space is being fully utilized, and they will let you hear it if supply chain is responsible for holding up a surgery or doing something that, so it's, the margin of error is low, but at the same time, I think like I said, I think there are just a lot of missed opportunities in the existing solution set today, where I think because people are overwhelmed with trying to solve the present problems, instead of taking that step back and saying, how do we just make this problem go away by making the process flow better?
Yeah, and so, when we talk about entrepreneurship, you know, we really think of the team. The team is really a selling point, right? It's
Right. Yeah.
what makes or breaks a company sometimes, right? How you all interact. And I just found it fascinating that you talked about the fact that your team has a lot of logistics and, you know, Amazon fulfillment background expertise, but not so much so in healthcare, right?
Right.
So I want to explore that a little bit, and wanted to know, is that, you know, a pro or a con? What happens when you go to a potential client and they look at your team? How have they responded?
It's I think it's because we're not from healthcare, it does create a little bit of intrigue when we come up with our solution, and folks sometimes will say, okay, I want to hear about this, right? Because I'm a big admirer of Amazon, I'm a big admirer of Google, I'm a big admirer of the latest and greatest sort of tools and systems and whatnot. So I want to hear about it. But I think the con is that on the flip side, because we're not from healthcare, there is a tendency, you know, and healthcare, I think, has a pretty good track record of resistance to being disrupted, right? And
Yes.
at least in this space,
Absolutely.
if I'll put it
I think
kindly.
we could all agree.
Yeah, and so I think that's so they love hearing about it. They want to hear more. They want to see it. They want to touch it. They want to feel it. But there are worries and challenges to having someone trying to introduce something that they feel like hasn't been done in healthcare, and because they believe healthcare is so unique and healthcare is so challenging that a lot of times folks aren't willing to take that first step. But you know, one of the things that I think does help us is that we have piloted this in hospitals, and we have worked with some large healthcare systems in level 1 trauma centers and research hospitals, in ORs that handle you know, the craziest, you know, cases that are, you know, in a 200-mile radius, right? And so we have worked with surgeons, and it's, at the end of the day, I think what they appreciate and understand is that we've done, like I said, we've done a lot of homework, right? We've met with, you know, I've been in probably about 50 different hospital ORs and systems. I've talked to you know, quite a few doctors, C-suites, you know, everybody in the hospital system, you know, nurses, administrators, you know, schedulers, and everybody. And so we've done our homework, and I think what they are coming around to is that I think that there is a forcing function, right? I think with the COVID, with the cost of healthcare, I think they realize that they have to do something different because the status quo
Yes.
really isn't working. And
Yeah.
but we being from not from healthcare, we need to prove to them that we appreciate the challenges and the complexity that they have, and we got to continue to validate that, to prove that. But I think every time we can successfully convince one, it sort of makes the next one a bit easier.
Great. So it's like you're teaching the client as you go along. Like, these are some of the use cases. These are some of the results we've been able to provide some of our previous clients. And that's how you can break down those barriers, right?
Yeah, definitely. I think there is a specific language. There's a specific way they look at problems, and I think, you know, part of our learning is to be able to explain to them in their language, right? Because we're all coming from, like I said, from non-healthcare space, and so we have our KPIs, we have our metrics, we have our you know, sort of tick list of what we think are the key uh, indicators of a successful supply chain or successful operations. And for healthcare, it may not, you know, it may not translate perfectly, and so we had to learn that, and we have to sell that to them. But you know, we do have a lot of great partners over the time that we've met, a lot of good people, and they are from healthcare, and they've been able to help us make some of that bridge as well.
Excellent. No, this is great. I think you're really providing a lot of value to the industry here. And of course, we're at a very crazy time, given the COVID-19 pandemic. how did you navigate that? And how did you leverage that opportunity to expand within the market?
Yeah, so, I would say sort of unfortunately, the pandemic really did put a significant strain on sort of our business, right? As hospitals, healthcare really scrambled to try to make preparations for the surge in cases. They really needed to prioritize their focus on making sure that they have the available tools and beds and resources for inpatient care. And then the other side of it is they really did try to put a lockdown on hospitals to make sure that they don't themselves become a source of outbreak. And so what that means is sort of innovation, new ideas, people who are not core to that patient care. It sort of kept,
Redistribution.
yeah, they sort of keep us at bay a bit because they can't, they decided they can't risk it during this time. And so we continue, we continue our conversations with them. We continue to use this opportunity to sort of to regroup, retool, to continue to develop based on our current roadmap of what we feel like our systems and capabilities needs to be in the next year or two. And so we're continuing to build. And so that didn't put a stop on that. But what it did was we quickly pivoted to, because of how hospitals were short on PPEs and short on supplies. So we sort of put on our supply chain professional hat and work with hospitals to help put them in connection with carriers, suppliers, warehouses, manufacturers, so that they can work around their current supply chain to make sure that they get the products that they need. And it's not something that we didn't change our business model to sort of go and profit off of that. But what we did use that as a way for us to demonstrate and showcase our willingness to work with the hospital systems and our ability to supply solutions and really to continue to make inroads in that, building that trust and relationship.
No, that's definitely seizing that opportunity, but you're right. It was less elective surgeries and procedures and more towards keeping, basic things like PPE stocked because, the global supply chain had, been impacted, creating shortages in certain areas. So, it's amazing to see that you were able to pivot so quickly.
Yeah, and some of it is really, making phone calls. We were staying up late at night, making phone calls to Asia, trying to secure container space for PPEs to come overseas, trying to secure, working with the ports to make sure that their cargo is being prioritized and unloaded and getting it off the ports. And so a bit of it is that kind of existing relationship that we've had with supply chain organizations, but really, like I said, what we really want to get back to doing is getting back to the hospitals, working with them in terms of really transforming their healthcare supply chain operations.
So we talked a little bit about risk, right? And being risk averse from your standpoint, but you also mentioned that some of the clients are risk averse as well and kind of a little bit resistant to change. How do you mitigate that challenge? Because part of, developing a breakthrough is going, pushing through that risk of failure and being scared of failure, especially when you're implementing these high-tech solutions.
Yeah. And so we, we have a sort of a crawl, walk, run mentality when it comes to implementing change. We don't necessarily go in and say, boom, we want to do this tomorrow. We can, and obviously we're very positive in our capabilities, but we really have crafted our sort of implementation to leverage, like I said earlier, existing data feeds that are available. So because we're pretty comfortable and pretty, I would say pretty handy around data systems, we can help them figure out where the data is coming from quickly without a lot of expensive resources from their own IT team. We were able to work with the OR teams to make sure, the CSPD, to make sure that our solution can become sort of a plug and play, right? And so we would divert a certain amount of cases over to our operation so that we provide the goods for 30% of the OR flow, for example. And so the only impact that the hospital really see at that point is the CSPD team. They have fewer cases to pick. And by the time it all goes up to the nurses, to the OR suites, it pretty much looked like whatever they were doing before, except now it's costing a lot less and it's creating a lot less capacity constraint within their hospital because we're picking the cases. We're not putting products aren't being stocked for weeks and months in the hospital themselves. And on the flip side, they're getting valuable data back, right? So they're getting immediate feedback about, hey, so-and-so, this surgeon's preference card isn't accurate. This is the level of returns that we're seeing coming back from that particular procedure. Here's what we see over the last 10 cases. So here's our recommendation in terms of if you want to make a change, a shift. And so immediately we were able, within 3 months, we're seeing almost 50% of the preference cards starting to change because they're learning from the data that we're providing back to them. And they're quickly making those adaptations where in the past, they literally would just ignore the preference cards and pick their own. The nurses would pick their own.
Wow.
and bring their own into the cases because they just feel like they don't have time to go figure out what's right, what's wrong, what's been changed, and our data and our systems not only introduce very little change for them, but it introduced a ton of wealth of data that they now can use to really improve their own operations.
That's great. So it's like data, creating this kind of system that's adapting to all the inputs as you're putting them in, and the providers also kind of making smarter decisions as well. So it's like a self-learning, self-evolving system.
Exactly. I think it is, it's a system, right? Everything is a system. And one thing that we noticed in the past is that things going one way and it stops, right? All the non-unused goods, all the waste, everything, it becomes a data point within the system, but it never gets extracted, it never gets validated, it never gets used for any purposes other than potentially patient billing, and sometimes not even that. And so what we did was to say, let's make sure that we always close the loop, right? When we put something in the hospital, we get something out of it. We learn what has been used. We don't go and make crazy claims after one case, but over time, right? And what you see when you go on Amazon and you go shopping, right? They're telling you, well, people who look at this product ended up buying this item. Right? And so it gives you a lot of intelligence. They don't force you to go buy that item, but they give you information. So now you're making better decisions about, well, maybe I should take a look at that item, right? Or a doctor or a nurse may say, maybe, oh, well, yeah, I'd rather use that if I could use that, right? For the same price or for a lower price. So that information data, I think people have been starving for. And I think in even our earliest implementations, people have really seen the value and the opportunity that they have when they are able to see that information back in real time.
Yeah, the power of data.
Who knew?
Yeah, who knew? So, what is the one recommendation you wish someone would have told you before starting your company, right? Here you are, you're not so risk loving, but there was kind of sort of this opportunity. It wasn't like all the stars had aligned, but you said, we're still going to go for it.
Yeah. And,
back.
and it may seem cliche, but really so much of starting your business, you almost have to experience it for yourself, right? It's really, really, I think in some ways it's really hard to just learn from others purely, but really a lot of things have been said, right? It isn't so much that someone didn't tell me this or I haven't heard about it from some podcast or some other interviews, but really I wish I would have understood this piece better, which is I think you need to really own and love the solution that you're bringing to the marketplace, because the reality is you're going to be selling it. You're going to be talking about it. You're going to be living, breathing this solution over and over again. And you're going to be meeting a lot of sort of people who are against it or going to throw different, challenges to it. And so if you don't have confidence, if you don't have, if you don't fully embrace the solution that you're bringing to the marketplace, it's very easy to feel very discouraged and wanting to sort of say, you know what, I'm just gonna go do what I'm comfortable with. And so I think, I like I said, it's not necessarily that no one said this before, no one told me about this, but I think this is something that I probably would have loved to appreciate more, as I'm going into this sort of embarking on this particular journey, was that really I had to understand that there is a lot of defending your position, a lot of explaining your solution, and you can never the people who are successful entrepreneurs, they're seen like tirelessly constantly selling their product and pushing new boundaries, and that's something that I think I had to experience for myself, but I wish I would have known more about that when I started it.
Yes, I hear a lot from entrepreneurs, and it's kind of like, when you take this journey, you kind of have to be a little crazy. You have to be a little like obsessive about what you're doing, because it's something new. It may not be out there in the marketplace, where you may have competitors that are doing parts of what you're doing, but not in the same, way that you are doing it, right?
Yeah.
So you kind of have to, submerge yourself completely, profoundly into what you're doing.
Yeah, I mean, even within one healthcare system, right? You may start at the very top. You meet with the CEO, then he said, he or she said, go talk to my supply chain person, go talk to my CFO, go talk to my, and so even within one healthcare system, you could be reselling and retelling the story, for 20, 30, 40 times. And I think, you gotta show the same level of enthusiasm for the solution as you had that first time you presented it, and you gotta be able to be able to answer and learn and constantly be growing and adapting to the needs of the needs of the particular person that you're talking to. But really, just like I said, you have to love it, otherwise it will start to feel just that pressure, or that it becomes I almost say tiresome, or just hard for you to continue on a day-to-day basis.
Right. You have to have that passion, that love for it, because that way it doesn't seem like a challenge, right? It seems like you're following what you really love to do. Yeah.
Or at least you're very willing to take on that challenge, right? It's a challenge that you think it's worth overcoming.
Yeah. So I'm going to ask one more question, because I see some Q&A, some questions posted on the Q&A. So thank you. Don't be shy. Definitely type up your questions there, and then we'll get Tim's insights into his business, supply chain, and healthcare, and all these different topics that we're talking about. So what's your vision for the next 5 years?
So we, as we got going, we created a roadmap of where we thought the opportunities are, based on hospital spending, based on where we hear the challenges are, right? And so we created both a technical roadmap as well as kind of a product roadmap. And so we put that out for probably 5 to 7 years. And so we're following that, and we're working through those different areas as we have the opportunity to continue to fund some of these technical developments, and as we have opportunity to pilot and test out these. So we're continuing to grow and making sure that we create the full complement of solutions that that doesn't make us just yet another product that hospital has to manage, but really becomes a solution that they can feel like it becomes an ingrained solution as part of their operations. So we want to get better at data integration. We want to get better at systems integration. We want to get better at being able to provide feedback solutions, business intelligence back to the hospitals, right? So we have a product roadmap that we're following pretty closely. But the vision really is to establish ourselves in the marketplace. We are a early stage startup. We have our product ready to go to market. We have additional products that we're continuing to pilot and grow and develop as we speak. But we really want to establish ourselves in the marketplace. We've been in almost not full stealth mode. We've been talking to a lot of people, but we haven't necessarily put ourselves out there, even in a form like this, right? So we are ready because of our product where we stand today. We're ready to move forward. We're ready to sort of go broader in our marketing approach. And so I think in the next 5 years, our vision is that we would start to get established in probably multiple regions, that we would have fulfillment centers, and we would start to be able to take on additional capabilities in order to make sure that we have a well-rounded tool set to support the healthcare systems.
No, that's great. So one more clarifying point, because I think the attendees will also want to know. So you're early stage, that means that you haven't gotten any VC funding, but so that means that you have been bootstrapping, or did you raise a family round?
It's we really bootstrapped this. I mean, it's we've been fortunate enough that we had good contacts, and we've been invited into different systems to help them with certain projects and assessments. So before we had an actual solution set to offer, we were plain consulting, not plain consulting, we were consultants to hospitals, and we were able to generate revenue to then reinvest into our business. And so over the last couple of years, we really have, it has been, we relied on our sort of co-founders' investments, as well as the revenue that we've been able to generate to fuel the business. We do at some point look to do some fundraising, right? But I think what we would prefer first is to have a healthcare system who wants to partner with us. We've worked with several VCs that are embedded within healthcare systems who are interested in the solution. I think really it just comes down to terms, and it comes down to who the right people are to partner with to not only make this successful, but really become an evangelical about our solution and help us push it out to the other healthcare systems.
No, that's great. Thank you. So let's go over to the Q&A. We have some amazing questions here. Thank you to all of you who have typed some up. And I'm not going to go necessarily in the same sequence. I'm actually, what you just mentioned is a great segue, because you said that you're willing to partner in a venture with hospitals and healthcare organizations. And that's actually one of the questions we had is, are you willing to partner? And so what are the risks of partnership there?
I think from my perspective, with any sort of startup business, I mean, the partnership, the risk really is that, whether or not, how quickly this will be adopted, right? And whether or not one of the existing established players is going to get smart to this and figure out how to quickly implement something like this using their sort of market power to try to implement this. The one thing that our experience tells us is that it's not that easy for an established players to pivot and transform their solution set into something resembling ours. And for one of the examples that we had was, look how long it took Walmart and Target to really catch up to Amazon and e-fulfillment, right? And it's not necessarily that they didn't know how or they didn't want to do it, but it's a matter of their systems and their people and their base and their revenue. And everything scale, is right? Yeah, and everything around them is based on pushing goods into retail stores, their distribution centers, and their systems were not built to sort of create custom orders they're created to ship bulk, to store bulk. And so there's a lot to change, and there's a lot of mindset to change. And so from a risk standpoint, I think it's less, probably, I would say first foremost, it's going to be the risk of how quickly people will adopt this. And we based on our conversations, I think that is going to be the one that is going to, until we get there, that's going to be a risk, right?
Right.
And like I said, there's always inherent risk of whether there's existing players going to be, going to be challenging in the marketplace. But I think we put that lower on our sort of potential risk, but it is something that we do ponder and think about. But from a partnership standpoint, I mean, obviously we're open to partnerships. We think, because of where we are, we definitely, appreciate people and introduction, and, anybody who can help us sort of make that jump over into healthcare and bridge us into healthcare. And so we appreciate anything that can help us get there. But yeah, we're definitely open to it.
Great, thanks. So the next question is, what are the businesses in which you see opportunities in the current environment? So I guess that means within supply chain, which components of those have the most opportunity?
I think because of sort of what COVID did to the whole supply chain ecosystem, and really kind of expose, even hospitals that's done really good job at stockpiling, they haven't been able to necessarily, just because they stockpile a lot didn't mean that they were able to supply their hospital any better, right, than anybody else. And so I think the opportunity is how to shorten that supply chain. So, we've gotten so used to product coming from overseas, we've gotten used to manufacturing overseas, that the raw materials, the know-how, the capacity, the people, all that has moved overseas. And so how do we making sure that we not necessarily to stockpile, but to shorten the lead time from securing the raw materials to the point that you're able to get a PPE into the hospital? I think that's a great opportunity for people to be thinking about. And there's a lot of people doing that already, right? Creating face masks, shields, things like that. And so that's one huge opportunity. I think just a matter of figuring out how to make data better, right? I think one of the things we also saw was, Hopkins create the COVID dashboard, right?
Yes.
And people loved it. People clamored over it. The amount of information that's available. And so I think not that people didn't understand the power of data or the value of data, but I think people have an understanding of how that can quickly help make better decisions. They're pushing their governors, they're pushing their, political leaders to make better decisions based on data. And I think that's another sort of great opportunity that I think is coming out of this particular environment now.
Great. And that's a great segue to the next question, which is, how do you ensure accuracy of the data? The systems, the dashboards that we build are going to be as good as the data that's provided.
Yeah. And so I think this is I would say almost a fallacy that people get it themselves into, is they believe the data is not right, so they don't take action on it, or they feel like they need to wait, they need to clean up the data before they can do anything about it. And what myself and my peers have learned in our experience and work is that, look, first go around may not be perfect, right? But what you really need to do is, and I mentioned this earlier, you need to close that loop. You need to learn and continue to build on that system, right? And in graduate school, I took a class, and it's about how to implement change. And you see that the change never gets 100% adoption, and it takes a long time to get there. And what happens is people get impatient and people try to change the solution midstream. And then all of a sudden now you got people still trying to adopt the first solution. And then I got a new change coming in, and then you got a third change coming in, and it just layer upon layer. And pretty soon you got 8, 9 different ways of doing business in your company, and you're struggling to figure out how to clean that all up. And so what you do, you approve another change, right? And so what I would say is that data is almost the same way. You're spending all your energy trying to clean the data up front instead of saying, run with the data that you have, because it's gonna prove itself out, whether it's accurate or inaccurate. And if it's inaccurate, because you used it, because you planned to it, now you know what is inaccurate about it. You can then fix it, so the next go around becomes better, and next go around becomes better. And so I think my advice and my suggestion really to folks who are working with data is, don't be so scared of, don't be trying to prove that data is perfect before you go, right? I think you need to figure out getting the data, making the data work, thinking about what decisions you can make and can't make with the data that you do have, and make sure you have flexibility and you have capacity to make change along the way, and you understand what your potential error rates are, what your tolerances are, and all that stuff. But really making sure you run that data all the way through, and then making sure that you learn from it and apply it to the next stage, right? And when I say with the preference cards, they always tell me, oh, preference cards, no, they're not accurate. I said, okay, but guess what? People are picking your cases off of those preference cards downstairs. They are, right? Whether you think they're accurate or not, they're using it. So why don't we pick it based on your preference card? The first time I bring it up to you, you pull out the stuff you don't want, you put in the stuff that you want, bam, I got a brand new preference card for you right there, right? I just fixed it for you, right? And next time you said, oh, it's changed again, that's fine. We keep learning and we keep growing, but that new data that I just got for you is now X% better than the previous set you had. And because you weren't willing to do anything about it, you've been living with that bad data for the last X amount of years.
Many years.
Yeah. And so
sometimes.
So I think, it goes back to, you can't just let that bad data be something that prevents you from making that first move.
No, all amazing suggestions. Thank you. So we're getting to the end. It's hard to fathom that we have to end this amazing interview / discussion conversation with you. I know I've learned so much. And, the Hopkins community is really a family. We're here to support one another. And, I want to know how the Hopkins community can support you.
Yeah, and so I think I mentioned earlier, we love to, we've had some wonderful people along the way that helped us make introductions into healthcare systems. So I think whether you are someone who works in a healthcare system, decision maker, someone who has access, who can help us network with the right people in the hospital systems, whether you are a supplier to the healthcare, to the hospitals, right? And you want to explore a new way of delivering your goods more efficiently and more effectively into the hospitals. But so anybody who works in this field, who have a stake in making sure that the supply chain is working for you, we love to hear from you. We love to partner with you to figure out how we can work together in creating a better supply chain. And in the long term, we love to recruit from the Hopkins community. We love to have candidates from the Hopkins community. I would love to be, that's something that I've always, obviously having graduated from Hopkins, I know the caliber of students and people that are going there. So I would love to have more Hopkins alums as part of the team. And so I think those are all areas where I would love to continue to explore and work with fellow Hopkins alumni and students and staff like yourself.
Great. Well, unfortunately, we're out of time, but Tim, thank you so much for your time and your talent and insights. We want to thank our participants for joining today. And a follow-up email will be shared with you following the webinar, and that's going to have the recording and a list of resources and our event schedule. As I mentioned earlier, this is going to be a series, so look out for the next one in about a month or so. There's so much amazing innovation and talent here at Hopkins, so we want to showcase that. And we were talking just before, Tim, we want the community to support each other and to connect each other. So you know, everybody, go onto the Standvast Healthcare Fulfillment website, take a look, connect with Tim. And we also have other resources in terms of, Hopkins alumni. There's One Hop, which is kind of like a community where you can connect with other alums, look at events, etc. And we have our Hopkins alumni calendar. There's tons of webinars, panels, all kinds of virtual events. So take a look at that and take advantage of it. And so, yeah, we hope that you'll join us again at a future webinar. And thank you all so much. Thank you so much, Tim. Thank you.
Oh, thank you. Thank you for your questions, and I appreciate everyone joining today. Thank you.
Great. Take care, everyone. Thanks so much. And we'll see you at the next one.
Bye-bye.
Bye-bye.